So I wanted to take a moment to explain a little bit about the technique of dry needling and how we can make sure it's most effective. Obviously, experience does matter, and here's why. What we're trying to do is relieve tension in a small band of muscle. So if you think of a muscle made up of multiple hundreds and hundreds of bands of muscle, we're going to try and impact the one that is inflamed, is irritated, is in spasm. And it's that thickening rope that you feel in a muscle when it's irritated. So let's pretend that this is the band of muscle within the muscle that's irritated. Now you need to get in and actually perfuse that band. What that means is you want to puncture it, but you don't want to go past it. So you want to find the band and then repeatedly enter within that band to finally get some blood flow stimulated back into that area. And they find that after actually needling that muscle, it happens pretty rapidly, as in immediately. So let's see what that looks like. Now, if I have the needle here, I'm going to try and hit it, okay, through the skin. I'm missing. Even just off by a centimeter, I'm not getting the effect until boom, there I get it. And it's actually pretty accurate to what it would appear like if I were actually working with the patient. Not that it moves that far, but you'll get a twitch response, means the muscle will jump. Now, one of the things that's not talked about a lot, and it's especially coming into play with the face, but also other areas as well, but even more so, and definitely in the face, is that we want to use a specialized needle so that it's not too intense. If it takes a long time to find that area of spasm, the more times I get in there and poke around, it's likely to irritate the muscle and give you a lot of soreness and bruising. Really not a comfortable experience. So a specialized needle, this is a very specialized needle that limits the amount of irritation any irritation that you'll have. You'll just get that twitch response, and that's what we're looking for. Now, one of the hard parts about using the specialized needles is that they bend easier. So it takes a lot of proficiency to be able to use these specialized needles. If you're not using these needles, then it's going to feel really intense, where you're just using a huge needle to try and get at it, or a needle that's not as effective. So there's different types of needles. We want to make sure that we're using one that we get a nice, relaxing, strong twitch, but not irritating where it's going to bruise the surrounding areas and really irritate things for days or even weeks. Again, with this needle, if I go too deep, no response. If I go too shallow, no response. If I go left or right, I'm not hitting it. It's just this small little area that, as you gain experience, you can start to feel immediately where that band is. It's very subtle, and as I said, with 10 years of experience, you can start to get a sense of, okay, where within that muscle do we find that band? You can do all the needling you want, but if you're not hitting that really, sometimes it feels like a strand of dental floss. That's how thin it feels. But once you finally hit it, that's when you get the response and the jump and the twitch, and you'll feel it.